Once a wealthy city in one of the most prosperous states in the nation, today over one-third of Hartford's residents live in poverty. 40% are children under the age of 18. Relative to its size, Hartford is the second poorest city in the nation. But if you look behind the numbers to the people and partnerships committed to creating a thriving community and building a culture of health, the story is quite different.
I think typically when you think of health, you're thinking of physical health, emotional health, and community schools address that and much more. So we actually do have on-site medical services as well as mental health services. But in order to get to the root of whatever the issues are within a particular student or their overall family, you need to address a multitude of issues. So a parent can come into a community school, and if they need support with finding a job or with fixing their credit, for example, they can get that support at the community school. If they're worried about their children and whether or not they're succeeding academically, they can get that support at a community school. So when you have a child that is succeeding academically, a parent that feels stable because they have stable employment and they're receiving support from, let's say, the Family Financial Center, then overall those factors together ensure that the family is a healthy family.
The village is known for working with behavioral and mental health issues within the community, and tied to that is financial health, and that those two things are just not going to be separated at any point. The way that we think about behavioral health and mental health and how those things tie together is essentially that, we see families, we've been in business for over 200 years, we've been working with families around their behavioral and mental health, but our families are also low income. And so a lot of the issues that they come in with are about financial stresses. If you take some of those stressors away from families, that their overall family structure will improve, that their children's behaviors, their children's ability to grow within the family will improve, and that the family overall will be able to move from a situation of poverty to more financial stability.
Building a culture of health in Hartford is really important. At United Way, we're undergoing an organizational planning here in Hartford. And we tend to have, in the past, looked at our work in a very siloed fashion. So we look at education, children being successful, family financial stability, and health as three separate silos. And one of the aha moments that we had as we were going through our organizational planning was that health really underpins children being successful and families being financially stable. If we turn that around, we also know that kids who have a good education, who graduate high school, tend to have better health. People with more education have better health outcomes. We know that families that are financially stable also have better health outcomes. So it's really just a win-win around education, family financial stability, and health. And that's really what makes a community thrive. And we certainly are all about folks in Hartford thriving.
By redefining health and addressing the multiple factors that influence it, we are harnessing the collective power of people and institutions outside of the traditional health field. Community leaders, residents, and other key stakeholders are coming together to address health through education, income, employment, civic engagement, and more. Collectively, we are approaching issues with a long-term vision, one that imagines a city where every family has what they need to reach their full potential.